YouTube video of the initial evaluation that I do every time in the clinic and when I'm working with the patient, particularly with pelvic and back and buttock pain, but I use it on every patient, no matter if it's a cervical problem, a shoulder problem, a foot problem, a knee problem, to get the pelvic balance. The first thing I do is ask the patient a couple of key questions. I want to know where the pain is, not because I'm necessarily going to focus on that area, but I also want to know what brought it on. If it was an accident, a slip, a fall, did it come on insidiously? I want to know all of these things. And then I say, what makes the pain better? What makes it worse? In other words, is there something that you during your day that absolutely makes the pain worse and you hate to do it? And is there something that you do, a piece of furniture, a particular stretch, a particular exercise that really makes it feel better? I ask the patient how they sleep, I ask them what type of a surface they sleep on, and how they feel when they get up first thing in the morning. I take a look at their medical history, I look at their medications that they're on, and any other contributing things that might go along with it. Now, the first thing I then do with the patient is watch the patient walk. So I'm going to have my patient come over here and walk for me up toward the window and back, and I'm basically looking to see if there's any aberration in the gait, if there's what I call a hitch in the get along. And then she comes back and I look at her, she comes in this side, and I want to see if she's vaulting a little bit on one leg, if one leg appears to be causing any type of an aberration at all. Then I'll have the patient turn around, and what I want to do is take a look at, and I want her ankles perfectly level. Bring this leg back for me, please. Thank you. Good. Keep it right like that. I expose the posterior superior iliac spines, and I get my thumbs underneath the PSIS. So I'm underneath, pushing up on them. I have the patient bend over as far as she can, all the way to the floor, and I look for one thumb to come up. In this case, it's the right. Come on back up, please. And let's look at that again. I'll exaggerate a little bit for the camera. And she bends over, and the right thumb tends to come up at the very end. That's a positive sign, positive standing forward bend test. Then I'll have the patient pull each knee into her chest. So she grabs the knee with one hand, doesn't matter which, pulls it right up into her chest, and I see how much my thumb moves. Go ahead and down, and do the same thing on the other side. And you see that left side moves much more. We'll do the right side again, and the right side doesn't move very much, and then she does the left side, and then the left side moves much more. And so again, she's got 2 out of 2 positive for right dysfunction, hypomobility at the SI joint. I ask the patient, can you walk on your toes? Can you walk on your heels? And then come on back over here towards me. Now what we're going to do is have the patient sit on the table, right up there, and scoot back so that your knees bump the table. Now, with my thumbs, I take a look and see if one thumb is sticking out further or in too far. And as you can see, this right thumb here is way forward, okay? So this should be here, but it's back here. And so something has gotten moved around in the pelvis that I need to address. What I will then do is test very briefly reflexes. And I'll come down here and I'll test the ankle reflexes. I will straighten the leg out and I will say, does that cause any symptoms when I do that? If she says no, I bring her chin down on her chest, slump her forward, chin slumped. Does that cause any difficulty whatsoever? She says no. Great, up you go. While I'm here, I hold the toes up, don't let me move them. The whole foot, don't let me move it. Push down. Good. Curl your toes on my fingers. Don't let me move them. Stiffen your ankle for me. Good. Keep the knee straight. Don't let me bend it. Bend it down. Don't let me straighten it. Hold it there. Good. I'm just testing muscle groups. Relax the muscles around the hips. This helps me to test the hip capsule. Hold it there nice and tight. Don't let me move it. So I'm testing the rotators. Swing it over this way. Don't let me move it. Good. Relax. Bring your knee up in the air. Hold it. Don't let me move it. Down you go, and don't let me lift. Excellent. Now I repeat that on the other side. Come on up. Does that cause any difficulty? If she says no, tuck your chin and roll forward all the way for me. And again, does that cause any difficulty? She says no. Good. You can sit up straight. We have no lower limb neural tension signs. Hold the toes up nice and tight. Don't let me move them. Just a repeat of the other side. Hold the whole foot nice and tight up. Push down. Curl the toes underneath. Stiffen your ankle for me. Keep the knee straight. Don't let me bend it. Bend it down. Don't let me straighten it. Hold it there. Hold. Good. Hold. Good. Relax the muscles around your hips. Hold it here. Don't let me move it. Swing it over this way. Don't let me move it. Relax. Bring this up in the air. Hold. Down you go. Don't let me lift this. Excellent. Now from there, I'm going to have the person lie down. And you can stop.